In this video, we're going to cover the anatomy of the skull. There are quite a few terms to get through, so you'll notice that I have the terms off to the left-hand side of the screen. That will help us stay organized, and I'll also make a practical checklist available to you so that you can follow along and take notes. I do just want to comment, though, the camera is set on a fixed focus, just because as I'm moving on the screen, it happens to kind of move in and out of focus, and I wanted to limit that. So I apologize if things are not as crisp as they could be, but I just didn't want the camera moving in and out of focus constantly. So let's go ahead and get started. Right now we're going to focus on the flat bones of the cranium. Here, this forehead bone is our frontal bone. Off to each side, we have our parietal bones. Lateral, we have our temporal bone. There's two of those, one on each side. And then on the back, we have our occipital bone. And you may have noticed these also correspond with the names of the lobes of the brain that they are protecting. So frontal bone, frontal lobe, parietal lobe, etc. Now, when you are born, these bones are not actually fused. You have gaps between those, referred to as fontanelles. And those gaps are really important because we need the skull bones or the cranial bones to be able to overlap and compress as baby goes through the vaginal canal or the birth canal. And also, once baby's born, we need to have room for brain development and growth. So these sutures here, which are joints where our cranial flat bones have fused, those actually won't fuse until about 2 years of age. If there is an instance, which it does happen, that a baby's born with fused sutures, they may end up requiring surgical intervention. So that way their brain does have space to grow as they develop. Let's talk about what these sutures are, though. This one here, which is connecting our frontal bone to our parietal bones, is our coronal suture. You'll notice it's running in the coronal plane. Coronal or corona means crown, so I think of it like wearing a crown on your head. Down the center, connecting our two parietal bones, is our sagittal suture. Okay, running in the sagittal plane. Off to the side, our temporal bone here is going to connect with our parietal bones through the squamous suture, right here. And for the squamous suture, I kind of think of like if you're tucking, your hair behind your ears, that's tracing that squamous suture. And then lastly, connecting our occipital bone to our parietals, we have our lambdoid suture. Okay. I'm going to reset and we'll cover the anterior anatomy or the frontal anatomy of the skull. In this section of the video, we are going to cover the anterior section of the skull. You can see that we have all of our terms over on the left-hand side, and we are just going to follow them in order. So the frontal bone we've talked about, but I want to cover it again now that we are in this view. Here we have our frontal bone, our forehead, and below that we have what we commonly refer to as the eye socket, known as the orbit. If we turn and look deep into the orbit, we can see this hole. This is the optic canal. That's where our optic nerve is going to pass through so that we can connect the eye to the brain. And also very noticeable is these kind of like cracks, what we refer to as fissures in the back of the orbit. We have the distinction between them based on directional terminology, so our superior and inferior. These are our orbital fissures, so superior orbital fissure, inferior orbital fissure. For the purposes of the practical, I have them combined into one popsicle stick. Below the orbit, we also have this hole here, the infraorbital foramen. This is a great one to break down the meaning using prefix, suffix, root. Infra meaning below, orbital is the eye socket, and foramen is the term that means hole. This is a term that's going to come up pretty often throughout the skeletal unit, so it's definitely beneficial to know that foramen means hole. If we break down this term, it ends up becoming below eye hole, and that's exactly what it is. Couple of bones that make up the orbit. We've already talked about the frontal bone. Okay. Off to the side, though, there is this medial and anterior bone. It's quite small. This is the lacrimal bone. It's where the tear ducts rest against. This is named just like the actual name for the tear duct, lacrimal duct or lacrimal canals. And so that's our lacrimal bone. Deep to that is the ethmoid bone. We're going to see the ethmoid again from the interior view. And then if we go back, straight back, oops, I'm sorry, we have our sphenoid bone. And we're going to see sphenoid lateral, inferior, as well as interior. So that's going to come up quite a few times. Moving on from the orbit, we have our cheekbone, which is the zygomatic bone. And then we also have this extension off of it, kind of forms this bridge. This is the zygomatic process. Process meaning extension of. So zygomatic bone, zygomatic process. Turning medial again, the bridge of the nose is the nasal bone. Looking into the nasal cavity, a couple of structures here. We have these curled structures called the nasal concha. We are able to see the inferior nasal concha and middle nasal concha. There is a superior, but we are not able to view that on our model. So, again, inferior nasal concha and middle nasal concha. The septum, the inferior portion, is the vomer. Up here is actually technically part of the ethmoid called the perpendicular plate. That is not going to be part of the practical. But if we're looking anterior or from the frontal view, the inferior portion of the septum is the vomer. We're going to see that again from the inferior view of the skull. The top of your jaw, like this bone here, this is the maxilla. And then the bottom of the jaw is the mandible. And you'll notice that there's actually two holes, and these are our mental foramen. Mental is the anatomical term for chin, and then again, foramen meaning hole. So I'm going to swap out my terms and we're going to focus specifically on the mandible now. For this section, we're covering the mandible. If you draw the term mandible during your practical, that is referring to this entire structure. Everything else is features that are part of the mandible. So let's go ahead and cover those. Starting off at posterior, we have this mandibular condyle. Condyle is a term for a bump that is involved in articulation. Articulation meaning moving. This is going to articulate with the skull so that you can open and close your jaw. Following that is the mandibular notch. It kind of looks like there's been a scoop taken out of here. And then at the anterior portion of this branch, we have the coronoid process. So mandibular condyle, mandibular notch, and coronoid process. Now I said the term branch, that's because this is the mandibular ramus, and ramus is the term meaning branch. And you can see the mandible is branching upward. You can say ramus of mandible or mandibular ramus, whichever term you prefer. That mandibular ramus is going to meet the mandibular body, this section, at the mandibular angle. And again, angle of mandible, body of mandible, mandibular angle, mandibular body, whichever you prefer is fine. Mandibular ramus, mandibular angle, mandibular body. Last thing I want to cover here are the two sets of foramen. The mandibular foramen is back here, kind of near where the mandibular notch and mandibular condyle are. And then again, we mentioned this earlier, our mental foramen, which is on the chin. For the inferior view of the skull, I have removed the cap to make it a little bit easier to hold, and I've also removed the mandible. So for organization, I am kind of going from a posterior to anterior direction. And we're going to start off just reviewing that here we have that occipital bone that is protecting our occipital lobe. You'll notice that there's this bump here on that occipital bone. This is our external occipital protuberance. Protuberance means protrusion or bump. External, it's on the outside, and occipital because it's on the occipital bone. The external occipital protuberance is going to serve as an attachment point for the trapezius. This helps with maintaining posture and kind of holding your head upright. If we follow along right towards the middle, you see this very obvious feature here, this large hole, which is exactly what it's named as, foramen magnum. Foramen meaning hole, right? Magnum is referring to that it is large. This is where our spinal cord is going to pass through to connect to the brain via the brain stem. And on either side, we have these bumps called the occipital condyles. Remember, condyle is a bump for articulation. Let's see if you can see it also laterally a bit. These are going to articulate with the first vertebrae, your cervical 1 or C1 vertebrae, also known as the atlas. As these condyles articulate with the atlas, they're going to glide kind of like in this motion, allowing you to nod your head yes. Quite a few holes, as you may have noticed. So let's go ahead and cover those. Just outside of and kind of under is this hole here, the jugular foramen. Okay, it's kind of like a peanut shape on some of the models. So that's where our jugular vein is going to pass through. That's the jugular foramen. And anterior to that, you have the carotid canal. Now, the carotid canal is not like an open hole in the model. Your carotid artery goes into this area, but then it's going to take a little bit of a turn, making it a canal and not a foramen. So jugular foramen here, carotid canal just anterior to that. If we move further forward or further anterior and medial, we have these two openings here. This is the foramen lacerum. And then off to the side of the lacerum, we have this set of foramina, the foramen ovale, and you'll see it has a nice oval shape. Okay. So that's it for the foramen and the carotid canal. I do want to move lateral though for a couple more features here. You have this very prominent bump. Let's see, that's a pretty good view of that. This is our mastoid process. This is an attachment point for the muscles that help you chew. And if you're familiar, the proper term for chewing is mastication. So mastoid mastication, your masticatory muscles are going to attach here. You also have this fang-shaped structure. That's a pretty decent view. Let's see if I can go from behind it. See? That's the styloid process. Styloid referring to like a stylus, like a pen. I've also heard people reference like stiletto, like a sharp heel. Styloid, I think of stylus, like a stylus pen. We have more tendon and ligament attachments here that are involved more in the throat. And then just beside these, you have your, and I apologize that I'm blocking the list, external acoustic meatus, just here. And that's going to be like the bony surrounding of your ear canal. This is another good one for context clues. So external on the outside, acoustic, we're referring to sound. Meatus is like an entrance or pathway. Okay, so mastoid process here, styloid process, and external acoustic meatus. Just in front of that is this very smooth, kind of like a curve. This is the mandibular fossa. Fossa is a term that means depression. And this is actually where, and I'm going to bring in the mandible, this is where your mandibular condyle is going to articulate with the skull. It fits right in there so that you can open and close the jaw. So the mandibular fossa is just anterior to where your external acoustic meatus is. We're going to focus at the roof of the mouth now. Sorry, I'm trying to hold the spring over to the side. The posterior portion, that's the roof of your mouth, is the palatine bone. And then extending forward or anterior is the palatine process. Remember, process is extension of, so this section is an extension of the palatine bone. And then I had mentioned earlier, I'm going to add in a term here, that we would be seeing the vomer again. Okay, that is our septum. And now when we were looking at the frontal view, it was just the inferior portion that was the vomer. From the inferior view of the skull, though, this entire part is the vomer. And then off to the side, we have two plates that are going to serve for muscle attachment for various jaw movements. We have our medial pterygoid plate and our lateral pterygoid plate. And so they kind of like start with the PT like pterodactyl, but we don't say the P sound. So this is medial pterygoid and lateral pterygoid. Okay. Last thing we need to cover is the interior. So I'm just going to go ahead and get our terms set up for that. The last view of the skull that we need to cover is the interior view. We're going to start off talking about the ethmoid bone. If you recall, we also covered the ethmoid when we talked about the bones of the orbit, and so it's deep and medial. So this is ethmoid here. The ethmoid has two features that I'd like to discuss. This one here is the crista galli, this protrusion here. It's going to separate our olfactory bulbs from the brain, or of the brain. That has to do with your sense of smell. Speaking of, we also have this cribriform plate. It has this spongy appearance to it. There's little holes and channels for our olfactory neurons to go from the nasal cavity to the brain, and that's going to transmit our sense of smell. And the olfactory bulbs that the cristagalli is separating are going to rest on this cribriform plate. To be able to distinguish between the two, I know it's a little bit silly, but I just kind of think of like Crista's in the crib. So cristagalli is inside of the cribriform plate. I also mentioned earlier that we would come back to the sphenoid bone. So here we are. This whole section here is our sphenoid bone. If you recall, we talked about it back in the orbit. I also believe I failed to mention that it's inferior. Here, it contains or is made of those pterygoid plates from the inferior view. So those pterygoid plates are part of the sphenoid bone. From the interior view, we have these curved structures. The larger of them is our greater wing of the sphenoid bone. The upper, smaller curve is the lesser wing of the sphenoid bone. And then medial, we have this pit-like structure called the sella turcica. Personally, I think it looks kind of like a saddle. This is going to house your pituitary gland. So the pituitary gland is going to rest right in there. And then lastly, I mentioned the external acoustic meatus is, the bony surrounding for your ear canal. We also have an internal acoustic meatus right here. You'll see it's just above where the jugular foramen is. So here's our jugular foramen. Here's our internal acoustic meatus. Our internal acoustic meatus is where we're going to have passage of our vestibulocochlear nerve. So that is cranial nerve 8, as well as a facial nerve, your facial nerve, cranial nerve 7. That's where those are going to be. Okay. That covers what we are focusing on for our practical. And if you have any questions, just let me know.